Hey guys, so I already finished breakfast and I'm gonna talk about some updates with my nursing career. So I've been a nurse for about 6 months now. So I was hired on July the 14th and I passed the NCLEX on June? I don't remember, but I might need to. What the heck? I don't remember. When did I took the exam? I think I took the exam. It was a June, July, August. But anyway, so the hospital that I was working as a CNA or a PCT was also the hospital that hired me as a new nurse, which is really amazing because I didn't really have to look for, a bunch of places on where I could start. And it might be very terrifying to work as a new nurse, especially if you don't have any experience like I do, because I graduated in the Philippines for a long time ago. I got my bachelor's degree in nursing in the University of the Visayas, and I am from Cebu in the Philippines. So I actually attended 2 universities. So I went to University of Cebu in the Philippines at first, although I failed in my 3rd year. So I failed my pharmacology and my maternity class. So in that university, because I failed 2 major of my subjects, they eventually kicked me out from school. And that was a really harsh word, but yeah, I was kicked out and I was about to give up nursing. Although I was like, maybe I'm just gonna go on because it's not easy to, switch to a different course. And I felt like it's gonna be like a waste of time already. So I went to a different university where I graduated, which is the University of the Visayas. And I did end up finishing my degree. Although I keep on failing the licensure exam in the Philippines, I took the licensure exam for the 4th time and never passed and finally gave up. When I gave up, I went to a different career. I was an ESL teacher. I went to Dubai. I work in a ladies salon and spa, which is the best one. It was really fun. Next, I work in a rent-a-car company, and then finally moved here in the United States. So before that, I was already like giving up nursing. I never thought about going back to nursing anymore until I came here in the US. I still don't have any idea as well that I could take the NCLEX exam, even though I wasn't a registered nurse in the Philippines. I only learned that later on, probably after being in the US for about 2 years, from a friend of mine that I used to go to school to when I was in high school. So I used to work as a PCT and then finally a CNA, and then the story begins. And finally, I become a nurse. So I might be talking about a different story about how I prepare for the NCLEX. I did have an old video about that you probably need to check out. Although I need to make an updated video about my NCLEX study schedule. Anyway, so on my first month of being a new nurse in the hospital, so I am in a MEDSURG telemetry unit. We basically handle different type of cases of our patients, post-op patients, patients who are there prior to surgery, patients who are monitored with telemetry, different type of patients. And I felt like it was a really tough area for me to start because being a nurse, which is really an experience, and the company or the hospital that I'm working with is really awesome because they really took me in. I have a paper here, a cheat sheet, because if I won't have this, I would not gonna be able to talk right. For the first 3 months, I was in an orientation / preceptorship. Basically, I am hands-on and I'm working as a nurse with a preceptor. So technically, she's just with me in case if I have anything that I need to ask for her. She showed me how the routine done in the unit and what to do. Basically, she's just there to guide me. So during my preceptorship era, basically there are different courses or trainings that I have to attend, including ACLS, BLS training courses. The recent one that I had was the Code STEMI. And then aside from that, we also have different modules or courses that we can access through SABA from time to time. It's just like some education that is applicable in our facility that we need to complete. So we've been doing that once in a while. Before I started, my anxiety was way over the top. Like, it was crazy. I have a pre-shift and a post-shift anxiety for about 3 months, I guess. Probably after 3 months, my anxiety kind of lessened out a little bit, and it wasn't as worse as before when I first started. And I still get that feeling of pre-shift anxiety, but I can basically handle it. But now, working as a nurse for about 6 months, my anxiety level from the top is actually now over here. I'm still anxious, but I can balance it out already. Also, documentation. So when I was in the Philippines, the only experience that I have is my clinical experience during the universities. So since it was way back, our documentation before is through, just writing everything in a report sheet. And then when it came here in the US, it's the charting system here is different. I'm not sure with the other stuff, but because I've only worked once as a nurse, this is my first job as a nurse, so the only charting system that I've encountered is Epic. Before, when I started, it was pretty hard for me to use it because I'm not really familiar with it, and there's so many things to remember. I kind of learn more better when I'm done with my preceptorship because I can do my own thing. Now that I realize Epic is really a good documentation system for me because it's very convenient. Aside from that, with the charting, I was having a hard time before putting in nursing goals for the day for the specific patient. It was so hard for me to think what are my nursing goals for my patient, and it's been a hard time for me to write my care plan. Like, when you are taking care of your patient, you're basically writing in your nursing care plan, your nursing goal, and your nursing notes. It was so hard for me to put in all the things that I wanted to talk about with my patient. But now that I've been working as a nurse for about 6 months, it's not an easy peasy, but there's definitely a progress that I could already think on what to do with my patient, like the critical thinking, and I could plan ahead of time. So I can write my nursing care plan better. I could definitely say it was way better than it used to. The confidence level. Of course, being a new nurse, I felt like, I'm not sure about you, but in my case, I wasn't really confident. I never raised my voice. I felt like my voice is really itty bitty. When I did a care team before, we always have this thing that around 11 o'clock or 10:45, we have a care team where all the team members are going to talk about the patients, like what are the updates of your patients, the trendings, glucose levels of your patients, what are the new treatment that we need to do, if the patient is going to be discharged, or are we going to send this patient to a different facility, are we going to transfer him or her. And before, I remember when I was so new, I can barely talk and I always get so cold. I mean, I'm still nervous talking to the team, but it wasn't as bad as before. Like before, I just couldn't get a hold of myself. I always have to drag my preceptor because I feel like I don't know what I'm going to say. So yeah, I'm more confident in communicating during the care team. I'm able to speak for my patients, so I know where to talk to and what my patients needs, basically. Aside from that, you know, talking with coworkers, I'm also more confident about that. Being an advocate to my patient, now I can suggest with a physician or ask for an order, do some suggestion to the physician, like seems like the renal function of my patient is elevated, or there's a little change and it's drastically changing. For example, if the renal function is increasing, I'm questioning if are we still doing diuretics with this patient with this renal function, if my patient's potassium level is depleting. So basically, I'm going to let the physician know that, hey, potassium level is depleting. I see that you're still prescribing diuretics like Lasix. Are we going to continue this or should we stop it? You know, stuff like that. I can basically talk right now to the physician. Before, it was really hard for me. Like, I always question myself. There's two ways in how you can reach out to your physician, because it's not all the time that they are in the unit. They're also, you know, seeing different patients in different units. We can secure chat them. We can either talk to them in the charge phone or call them in their office. But usually we just do a secure chat. So I can message the physician, like, before you give medication to a patient, you just don't assume that you're gonna give it to that certain time. I usually go and check the last dose of that certain medication before or prior giving it to the patient, because there are times that the doctor just order it and then it would pop up, this medication is ordered, so now you can give it. I prefer for you as a new nurse to make sure to make time to check the last dose of that medication. So yeah, be an advocate for your patient. If there's any changes with your patient, don't be scared to talk with the physicians, because you know what is more safer to your patient. You're the one who's taking care of your patient. So whatever things that you think that it's not safe for my patient with his or her current status right now, make sure you tell the physician. You question yourself. Before, when I started working as a nurse, like, I felt like it's wrong for me to question myself all the time. I felt like I shouldn't question, you know what I mean? But right now, I definitely changed. I focus more on my patient's safety. Like, I think critically. I don't know, I feel like you're just gonna learn it. As you go, you learn how to think critically. Not every time that you would know what is best for your patient, but basically you notice things and you can eventually talk to the physician that, hey, I'm not happy with this level of, you know, hemoglobin, so it's trending down drastically, so we probably need to recheck the patient's hemoglobin again, just to make sure. You know, there's really nothing wrong with saying that. If the doctor would say, no, it's okay, it's expected, then also don't feel bad, because before I realized that I suggested something and I felt like it shouldn't need to be suggested, I felt really bad. This time I don't feel bad. I feel like I did that because I was nervous and I felt like the doctor needs to know about this. Maybe he has not know about this. So it's better to cover yourself. You know what I mean? Better to talk to them in advance, notify them. If it's not a big deal, it's good. At least you did your part as a nurse. So I'm more confident in, you know, advocacy as a nurse to my patient. Also, I hate talking over the phone, and that's the reason why I quit being a pharmacy technician, because constantly talking over the phone. I hate talking to the phone, but now I don't care. I answer the phone all the time. I always have this hard time before talking to different teams over the phone. I don't know why. Is it because maybe I'm anxious? Is it because I couldn't hear them properly? But now I just don't care if I don't understand what they say. I always say like, hey, can you repeat it again? I don't understand, and I'm not quite sure if I understand what you said. So basically just say like that. And being a new nurse, I'm more confident to say that, hey, I wasn't able to get what you were saying, or I want to try to clarify if this is what you have said, especially with a physician. Sometimes they give orders over the phone or even face to face. If I don't quite understand what they're saying, I will repeat what they said. And like, hey, did you say to increase the level? You said you were increasing the Lasix dosage, or did you say that Heplock? Did you say Heplock? We're not giving fluids anymore? Basically like that. So, and then they said yes. So that's the time. At least you clarified it yourself. You're doing something that would benefit your patient and benefit you, so you'll be considered safe. Other thing is time management. I felt like I talked too much, but time management, guys, it is a really hard thing to manage. Managing your time as a new nurse. When you start being a nurse in a med-surg unit or whatever unit you are starting, time management is a really hard thing to practice, because I myself was being anxious on how to manage my time. I don't know what to do first. I don't know how to organize. I don't know which patient I'm gonna attend to first, because these people want to be prioritized. All of them want to be prioritized. They feel like I need to be prioritized first. But as a nurse, you know you can't just pick whatever. You learn as you go. Like in my case, it was hard for me before to which patient I should go first. You know, as you come in to your shift, it was hard for me to decide which patient I should attend to. Let's say I have 4 or 5 patients, and I always have a hard time on which patient I should assess first and attend first and give medication first. There were so many things that I tried to experiment before I did, after you do the bedside report, after, from night shift, basically we pass the bedside report, I usually go to the patient and do some assessment, and then see them first, all of them, just talk to them a little bit, and then come back with their medication, which is actually very time consuming. So I didn't do that. The next step that I did was during the bedside report. That's the time I introduce to my patient. I do a little bit of objective assessment. Basically, I just look at my patient if they're breathing. At the same time, while the other nurse is talking, I'm constantly checking their skin, if they're swollen, if there's any bruising, like those type of things that are easy to see objectively with your patient, because at the same time you're also hearing or listening to the nurse that is talking about information about your patient. And before, I have to write everything whatever the nurse say. Now I just basically write whatever updates and the important trends that I need to know, any abnormalities for the past 24 hours or from yesterday and drastically changed from today. That's are the things. And I also like to know if the patient lives alone, with a family, private place, or in a facility. That's sort of the things that I need to know, or if they are homeless, because that's the thing that I could think if needs a social consult. Stuff like that. And I do the objective assessment. So after that, I learn how to do that. I go back to my stations after I already, do the bedside report. And then I check my lab trends from all my patients. On the labs, if there are abnormalities or critical levels, I need to tell the doctor. After I do that, I also read the last note of the doctor. And then I decide and I see which medications that I have. For example, if this patient is going for a procedure and they are NPO, I have to check if they have blood pressure medicine. If their blood pressure is high, I will call the radiology and ask them if it's okay with you guys if I'll give the blood pressure medicine. I know she's NPO, and they will say, yeah, it's okay. And then I will give it. And other medicines that are not important, like multivitamins and stuff, I won't give it. Just basically the important ones. And then for people who are having pain medications and asking for pain already, you know, there's certain type of patients that you just got in your shift and they're already complaining about pain scale of 10, whatever it is. Before I give them the pain medication, I really have to see on my patients first. You know, I want to see her pain levels from the last shift, and if I really think that she needs it soon, then I have to give it. It depends on their situation. Also, thyroid medication, make sure to give it early, and then I just go from there. And for those patients that have a lot of things going on, like they have NG tube, they have suction tube, they have Foley catheter, there's so many fluids, many things going on, I put them on the last because they are very time consuming. So as you go through, you learn how to manage your time. It's kind of more easy. It's not easy still for me. There are still times that it's hard because of the interruptions as well. But it's way better compared to when I first started. Other things. Delegating. My goodness. This was the most difficult thing to do. Delegating stuff to your coworkers. Before, I always think that I have to do everything because I also used to be a PCT or a nursing technician. So I know what to do. But before, I used to do everything because I feel shy in delegating this other stuff to the PCTs because I used to be a PCT and I don't know why I feel shy. You know, I never delegate before. But now I know how to delegate things, especially in the morning. The morning when you come into your shift or whatever, when you first come into your shift, that's the busiest time. So that's the time that you can delegate the other stuff to the PCTs. So once you do your assessment, preparing your meds, some patients wanted to, you know, let's say brush their teeth. They want to do their activities of daily living. Let's say they want to go to the bathroom. They want to change their soiled brief. If you are not busy in that morning, if you have the lightest team of your patients, then you can do that. But if your team is just really heavy, they're all sick and they're all needed to be taken care of, that's the time you can delegate to the PCTs. So you can always ask the PCT like, hey, I've seen that the blood pressure of my patient is, you know, high, very high. Can you retake it after I give my blood pressure meds in like 30 minutes? Can you retake it and recheck? That's the time you can delegate. And then if you see, like, while you're preparing your meds, you know, as I've told you, I like to review my patient's trends before preparing my medication. You saw that the heart rate of your patient is low. So you can either tell the tech that, hey, I'm gonna see other patients first, and when you're done with all your vitals, can you go back to my patient and recheck her heart rate so I can decide if I will give her metoprolol or not, stuff like that. And then let's say you're already in a patient's room, and then you prep them, you already did assessments and you give your medications, and eventually the patient wanted to use the bathroom. So I can take my patient to the bathroom, and then I have to move on to a different patients because I still have meds to pass. You can call your PCT and tell the PCT that, hey, I put 229 to the bathroom, and I instructed her to call. You use the call light when she's done. So just giving you a heads up, she might gonna call you guys. So can you help my patient whenever she's done? So basically that's how I delegate things. And before I used to have a hard time doing that, but now it came in naturally. And always thank your PCTs, guys. Don't just be bossy and demanding. Always appreciate them. Like, tell them, please and tell them thank you all the time and give them a pat in the back. I usually do that because I used to be a PCT. Like, it's so nice being appreciated. So appreciate your PCT, guys. And not only PCTs, you can also, if your PCTs are busy, just don't ask them. Ask other nurses. Before, I couldn't ask other nurses, but now I ask my coworkers, like, hey, are you caught up? And they would like, yeah. Can you help my patient go to the bathroom? I'm still trying to do this, and I'm going to this room, and I couldn't really attend her. And I called the PCTs, and they're all doing their baths. They will do it for you. Like the other nurses, they like it. And then, when you're not busy, offer to help. Like, are you caught up with your meds? If she's not caught up, if you see that your coworker, your co-nurses is, anxious and like she's everywhere and basically having a hard day, you can just ask them, hey, do you have any meds that you want me to pass? Because she can pull it for you and you just give it to the patient, or you can pull it together and then you give it to her patient. Like, I feel like if you have a really good team and you're communicating well, it's a really awesome place to work. And that's why I like working as a nurse. Now, it's like a love and hate relationship, but I like where I'm working at. So even though there are times that is really tough and I kind of makes me question my profession, at the end of the day, looking at your coworkers, I still love what I'm doing. So yeah, time management, delegation is important. Okay. Skills is a way different story because, again, I don't really have enough experience as a nurse, and everything to me is new. I'm from a different country. Everything's different. So I used to be so scared with the IV pumps because in the Philippines, as far as I could remember, we don't have IV pumps, and we just calculate everything and count the drops and look at our watch, and that's what we do. But here, that's why I already explained it to my coworkers that I am so scared with IV pumps. And yeah, now it's easy for me. I am even learning a new IV pump right now because we are going to change our pumps to a different IV pumps, which is I'm still trying to get used to it. But actually, we started using it on my last shift and it wasn't that bad. But yeah, my skills are kind of more better than before. So I was able to insert an NG tube by myself. I always offer myself to do that certain procedure, especially if I don't know that procedure. I will always offer myself to do it. The insertion of IVs, I'm still not good at it. I discovered that if I use the vein finder, I'm able to insert the IV cannula better. So this time, every time I wanted to insert an IV, I will use the vein finder all the time because it's easier for me and it's more convenient. And I always like to start the IV first, but at the same time I don't want to hurt my patient, so that's why I'm always scared to do that. But now with the vein finder, I will use that at least to make my patient at ease and myself at ease too. And if I still couldn't do it, then I will ask somebody to do it for me, especially the patients that are really hard stick. And what else did I do? Oh, I did my first code not my patient, but I did help and participate in a code before one time with my coworker's patient. So I did compressions because I'm not really familiar with the crash cart, but that's the thing that I told my manager that I wanted to be familiarized with a crash cart, and if there's any codes, I want to be there so I can observe more and know what to do. I also wanted to experience the ICU and want to float there, but I might do that next after a year of experience. I want to do the ICU and I want to see how it is, but I'm not ready right now, but maybe after a year I would be eventually ready. Chest tube, I'm always scared with chest tube If I'm not sure about it, I always ask my coworker. What else? I've inserted a Foley, dressing, changing the dressing. I always reassess my patients' skin, especially if they had surgery. I always like to see the wound and see if the pictures are updated and how many days the picture or the images were taken, and retake pictures just to see if any changes of the wound. I always do that. There's so many skills that I learned, and I'm more confident now, and when I want to learn something, I basically, especially if there's something new with my patient, a procedure that it needs to be done, I like to check it on Google first, and then I ask the nurse that is more experienced, and I want them to demonstrate it to me. And then when I had the demonstration, I will demo it again to them if I'm doing the right thing, and then I go to the patient. That's what I usually do. And if I still don't feel confident after the demonstration that I did with that nurse, I'll ask her to go with me. Like, for example, changing a dressing of a central line. It's a sterile thing, so I was so scared to do it. So I have to call the nurse to be with me at least when I am changing the dressing of the central line. And if I want to draw a blood, let's say I'm going to draw blood on a central line for labs, and I wasn't confident about it because I don't know, I was not confident with central line, so I have to ask another nurse to be with me at least and do that with me. So those were the things that, especially when skills, the only thing I could advise you is, like, if you don't really know what to do, just research and then ask the nurse, demonstrate, and then if you're not confident, have somebody with you, as long as, so to keep you feel more safe. And also, when you get home and you did something that was different, at least read something about it, like about chest tube. Let's say you have to read the chest tube because you forgot about it, so read about it just for you to learn, something. So that's how I enhance my skill. And I'm actually a visual learner, so I like also to observe first and then demo first before doing it, because that's how I learn. So what else can I talk about? Bedside report, or doing a report about your patient when you discharge a patient. Oh my god, I used to be so nervous about that, especially when you send a patient to a different facility and you're gonna talk to a nurse and give the report to that nurse. I feel like before I used to pee on my pants because I'm so scared, but now it's an easy peasy for me. Like, I don't know why I was so scared about it, but you're just gonna talk about your patient's information, and then you don't have to talk about everything. You just have to be specific. Let's say this is patient Mrs. Smith, she's 28, female, came in with complaints of dizziness and generalized weakness. When she came in through ambulance. Her O2 saturation was like this, vitals were like this, and then they decided to, whatever the doctor decided to do with that patient. So, and then we treated the patient with this one because she had pneumonia. She's receiving these antibiotics, and now pneumonia has been recovered. Now she's stable, and now she's going to your facility for a rehab so she can gain her strength. Like that, just like that. Before I was so scared. And then the nurse will ask you certain stuff, and then you can basically find all the answer in the chart, and you just tell them, yeah, this is the one. And then she's gonna have an appointment with his PCP on this date, so just to make a note on that. Those are the things that you need to do. What else do I need to update with you guys? But for me, it's way more easier right now. I thought it's going to be really hard and it's gonna be really long because I was really struggling the first period of time, but now I felt like there are times I'm enjoying it. And yeah, it's still a learning process eventually, but I'm just letting you know that I'm having a great time. There are times that it's pretty rough though, But I definitely am having a great time. I love being a nurse, and I'm thankful that I did start in MedSurg, because I don't have any skills yet, and I felt like it might be not for everyone. MedSurg might not be for everyone, but for me, it's a place where it's a good place to start for me, especially if you're a nurse that don't really have any experience and you came from a different country, and you graduated a long time ago, because it's way different from in the Philippines. I'm not really sure how the healthcare in the Philippines right now. Maybe it's about the same now, but during my time, when I compared it during my time and how our hospital does it, it's way different. So yeah, I think that's gonna be the update. Like, I don't know, is that a good update for you guys? If you have questions, you can comment down below, or you can follow my Instagram. I have 2 Instagram. I made a second Instagram, but I felt like I don't gain a lot of followers there. So I'm thinking to go back with my personal Instagram maybe, because I kind of like separated my Instagram with my personal Instagram and my social, Instagram, where I could do my vlogs and stuff. But yeah, maybe comment down below if you have other questions regarding the update of my 6 months. I don't know if I have mentioned everything, but yeah, that's about it, I guess. And I'm gonna go to work tomorrow. Let me know if there's anything else that I need to tackle, and then I'll try to talk to you guys, probably just like this, like a sit down talk and sit down vlog, if you're okay with that. So see ya, bye.